do you take on such a big thing? All right, well, you got to know all the hormones. You need to know where they're coming from, where they're going, you need to know their functions, and you need to know what stimulates and inhibits them, okay? So on that chart, what I added was, before it was a column that said notes, but I kind of removed that, and I kind of added in something like regulated by. What that means. Okay, what stimulates it? What inhibits it? So if I said to you PTH, parathyroid hormone, what's the substance that's actually going to stimulate the parathyroid gland to secrete PTH? What's going to stimulate that PTH to get secreted? Yeah. Calcium. But high levels of calcium or low levels of calcium? Low levels of calcium is going to tell the parathyroid gland to secrete PTH to get high levels of calcium in the blood. So regulated by is what I'm saying is what stimulates that secretion, what inhibits it, and in this case, calcium. Okay. So you need to know the hormones. If you don't know the hormones and where they're coming from, because I could talk about like parathyroid gland, if there's a tumor there, a lot more PTH is coming up. That's where a disease is coming. So you need to know where these are coming from and where they're targeted. Okay? You need to know all about these hormones. So again, to know you got to know that chart cold for you to understand the diseases. Look, and here's the chart over here in 2 pages. But again, I kind of made it into 4 pages through the blocks. Once you know all that, then we can go on to diseases. So what do you get out of this? All right, what should you know from A&P? Well, you need to know the hormones abbreviation and any synonyms, because they're going to be quite often written in, so if a doctor or someone tells you you've got to do a blood test, and they say PTH, you need to know what PTH stands for, okay? So what I'm going to use is, for my examples on here, is ADH. For all this, for what I'm going to show you next. So you need to know abbreviation. You need to know that ADH stands for antidiuretic hormone. You also need to know that vasopressin is also a synonym for antidiuretic hormone. Some people will use vasopressin. If they're going to say give a treatment of vasopressin, you need to know that's also ADH. You got to know these words. You need to know what regulates, i.e. stimulates or inhibits ADH. So in this case, low blood pressure is going to tell the body to release ADH, okay? High blood pressure will tell it, don't make it come out, right? You need to know where does it come from. Now this is kind of a weird one. There's only 2 that are weird like this. They're actually made in the hypothalamus. Now what other hormone is made in the hypothalamus but then stored and secreted from the posterior pituitary? ADH and oxytocin, right? There are a lot of other hormones that come out of the hypothalamus. Well, they come out into the bloodstream and they all target the anterior pituitary. In this case, ADH and oxytocin are the only 2 that are made in the hypothalamus but get stored and secreted from the posterior pituitary. Okay? You need to know where each hormone targets. Where are their receptors? Where are they located? So in this case, ADH targets the kidney, really the collecting ducts of the kidney, and blood vessels. Okay? You need to know the function or functions. There are usually many functions. You need to know them all for you to understand the signs and symptoms of diseases of these hormones. So ADH is going to reabsorb water. Just think of the name, antidiuretic hormone. If diuresis means to pee, to let out water, diurese, this is an antidiuretic. That means it's going to reabsorb the water into your bloodstream. Blood volume is going to go up, and what happens to your blood pressure? It increases, right? But also, ADH is going to cause vasoconstriction, and that too is going to increase blood pressure. This is why we sometimes call ADH Vasopressin because of vasoconstricts. Press, to constrict. Okay, it's making sense. Okay? So once you know all that, and that's the stuff you're coming into pathophysiology from anatomy and physiology. Once you know that, then this is the part I will be teaching you. Is it diseases? Once you understand the functions of it, then what happens when there's too much of a hormone? All right? For ADH, if we increase ADH high, that's going to cause an increase of blood pressure, which means you're going to have hypertension. Right? Makes sense. You need to know what causes the hormone to be released this much. Maybe there's some kind of adenoma, some kind of tumor of the posterior pituitary that's going to release a lot of this ADH. Again, that's where I come in. And there has a name to this. If you have a lot of this, if you get a lot of ADH that's coming out, then this is inappropriate amount of ADH. So we call this a syndrome of inappropriate ADH, or SIADH. Okay? Makes sense. Now, we look at the other end of the spectrum. What happens if there's too little of it coming out? All right. Well, ADH, if you have a decrease of it, then you're going to have a decrease of blood pressure, which means you're going to have hypotension. Right? Making sense. What causes the hormone to be released so little? When we get into it, you'll see there's a few different things. But let's say a stroke going to that brain, or that part of the brain, the posterior pituitary. It starts destroying the posterior pituitary, which means it's not going to release ADH. That can cause that. We have a name for it? Yeah. The name of this is called diabetes insipidus, or DI. Now, be careful with this, because it's not the diabetes that grandma's got. All right? She has diabetes mellitus. Okay? Diabetes insipidus doesn't have sugar in it. Diabetes mellitus, mellitus means sweet-tasting urine. In the 1800s, grandma, that's how they did it. Okay? We have better tests now. But that's where the mellitus came in. Okay? It's different. Okay? So after you do all that, all right, you understand the pathophysiology, then you take the other chart, and now you're going to fill in all that. So you'll have the same hormones, but what happens when you have too much of it, too little of it? Now, we're not going to go over all the diseases. It's way over the scope of here. And sometimes they're really not really significant. Okay? But all the I'm only going to assess you on the diseases that I talk about in class, that's in the PowerPoint, or what's in the textbook. All right? You'll learn a few other ones when you get into other classes and when you start going to your clinicals in real life and stuff, and you'll start building up with that. I need to get at least the foundation for you to move forward, okay? And sometimes we're not going to, like I said, we're not going to deal with all the different diseases about endocrine in this chapter, but when we get into, let's say, digestive, when we talk about secretin and CCK, or we get into the reproductive system and different hormones, we'll build that. So don't lose that chart. You're going to fill in things as we go along throughout the course, and you'll have a fuller chart when you get to your final exam. Okay? So that's what will happen. And I definitely want you to do the chart properly. What I'm saying by properly, don't cut and paste stuff. Don't have it where your friend could do one page and you'll do another page. That's not going to help anybody, except for the page that you did. All right? You've got to do each one. Is it going to take hours to do? Yeah. No pain, no gain. And don't, after you're done with it, don't put it on your fireplace mantle and then you have something nice over there and you can always refer to it. Have it so that you own it. Put it in your head. You write in those charts, fill in those charts. That's active learning. You put it on your fireplace mantle and just looking at it and reading it, that's not going to put it in here. You're always going to refer to that. So after you do the chart, I guess for fun, rip it up and do another one. See if you can do it from memory. Well, I don't want to be so drastic, especially in a high volume, fast-paced course like this, but you should be able to say to yourself, I know the function of ADH, like we just did here. All right? I mean, I did basically the whole chart in terms of the ADH just now for you. See how fast I mean, without looking it up or anything, I mean, 'cause I know it, but I mean, that's what you should be able to do for each one of them. Okay? So questions on this?